Hello, my name is Miriam Garcia Hawker. I'm a nurse practitioner who prescribes opioids for cancer patients. In today's video, we're going to discuss the opioid overdose crisis in Texas and explore how implementing mandatory naloxone co-prescribing could serve as a critical policy intervention. Although the opioid prescriptions have decreased, overdose deaths continue to rise, predominantly due to synthetic opioids like fentanyl. In 2023, there were 105,000 drug overdose deaths, with opioids involving 80% of all those cases. The economic burden of opioid overdose and misuse has cost the United States $121 billion. Naloxone is a life-saving medication that rapidly reverses opioid overdoses. However, it remains significantly underutilized in Texas. This highlights a need for urgent policy change. This crisis isn't just a national issue, it's also a pressing concern for Texas. Healthy People 2030 has set an ambitious goal of reducing opioid-related deaths from 25 to 13.1 deaths per 100,000. But when we look at the state of Texas, and in particularly Harris County, we're noticing a higher rate of these incidents. The Texas Department State Health Service reported a rate of 9.4 opioid-related deaths per 100,000. That's great, right? But when you look at the state of Texas, you see how large metropolitan areas are facing even higher rates of these opioid-related deaths. Naloxone can reverse an opioid overdose quickly when administered promptly. Despite its potential to save lives, it remains critically underused. A study by Roberts indicates that fewer than 1% of frequent opioid prescribers consistently offers naloxone to high-risk patients. The states have adopted various types of naloxone access laws. As you can see in this map, Texas is not a state that requires providers to provide a prescription. There is protection for providers and dispensers, and it also maintains a statewide standing order so that a pharmacist can offer it to you without a prescription. But nonetheless, we just do not have the dispensing rates that we would like to see. If anything, the CDC showed that Texas has one of the lowest dispensing rates in the nation. I was able to speak to a firefighter that gets to see overdose on a daily basis in the community, and I'm going to let him talk to you a little bit more about that.
Hello, my name is Eric Flores. I'm a firefighter with the Houston Fire Department. As a first responder, I witness the opioid crisis firsthand every day. Houston, like many cities, is seeing an alarming raise in opioid usage, especially involving fentanyl and all the other recreational drugs. Sadly, many emergencies result in death. Mandating a co-prescription in Narcan alongside with the opioid medication could significantly help the individual at need, especially having someone around there, particularly the one that called 911. It is crucial that the individual has life-saving medication before the emergency occurs. Let's make Narcan a standard part of opioid therapy in Texas, and together we can save lives and help people battling addiction. Thank you.
So the opioid crisis in Texas is severe, we get that. But we have the tools to make a significant impact. So implementing a mandatory naloxone co-prescribing for providers of high-risk patients has the potential to save numerous lives. Adopting this policy would decrease overdose fatalities, could reduce long-term healthcare costs, and would actually help protect our communities better. Thank you for watching my video. And just so you know, UT Health San Antonio has a website that people can actually request free Narcan to be shipped to their home. If you know someone that needs it, can't afford it, has concerns about buying it at the store or whatever, if you go to that website, they will actually ship it to you and it'll be for free.